Data from several sources demonstrates that physiotherapists are not clear about ongoing consent and related documentation expectations. Hi, I am Trevor, the College of Physiotherapists of Alberta's AI assistant. In this video I will help guide you through the topic of ongoing consent and the expectations for physiotherapists. Let's start by examining what this can look like in clinic. Yannick is assessing Angie's back pain. He gained consent to assess her back after a discussion about physiotherapy and the purpose of Angie's visit. During the assessment, Yannick casually lifts her shirt at the back to tuck it into her bra and slides her waistband down to see the lower part of her back more clearly. As they continue the assessment, Yannick can tell that something is off. Yannick has done many lower back assessments and this is routine practice for him. However, he can't remember if he told Angie that he needed to expose the area that he was assessing. This is one example of physical contact that physiotherapists may consider routine, but which clients may view differently. In another example, Connor has been treating Jasmine's ankle injury when she mentions her groin has been bothering her. He asks her to change into some shorts so he can better assess the area. She agrees and changes into the shorts. Connor gained consent for the assessment and provided privacy for her to change. During the assessment he continues to ask if it's okay to test her muscle strength and range of motion, which she consents to. However, he doesn't let her know that he has to palpate along the adductor muscles towards their origin. He notices that she goes quiet and tenses up as he does this. Connor received consent to do other assessment techniques but failed to continue the consent conversation once he began to palpate her injury site. This is another example of physical contact that may be routine for the physiotherapist but unexpected and unwelcome by the client, if they don't understand what's happening and why. In addition to obtaining ongoing consent, Connor and Yannick also need to document ongoing consent appropriately. The extent of documentation of ongoing consent should be reasonable for the clinical situation. It is not expected that Connor would list each aspect of the assessment that he gained consent for. But he would document that he obtained ongoing consent to proceed with the assessment of Jasmine's hip after explaining what that assessment would involve. Issues arise when clients are caught off guard and are confused by the physiotherapist's actions. It is best practice to continually discuss what you are doing and why during the course of assessment and treatment. Ongoing consent is a necessary part of building positive therapeutic relationships and helps to keep your clients feeling safe within the treatment space. If you have any questions, you can find resources on our website or reach out to the practice advisor at the College of Physiotherapists of Alberta.